We're here today with Jamey Edwards, who in the past decade has built and led multiple healthcare tech companies. He even took one public. He is now the president and chief strategy officer of Cairns Health, whose business is improving day by day healthcare for seniors so they can live more independently. Lots of cool things about that. I see this in my future. There are a lot of problems in healthcare. What exactly is this company intending to solve, if not them all?
Yeah, look, Tracy, I see it in my future too. So you're not alone. I just turned 50 this summer. So I'm staring down the barrel. I actually got my first mailing from the AARP. So,
Wow.
we're all there. Um, Look, I think that when we took a look at the roadmap for Cairns, which was formerly known as Coco Home, and we're rebranding this month to Cairns, we said, what were the two most important trends in healthcare and how can we be at the center of them? And when we evaluated and did all the journey mapping and did all the analysis, what we discovered was, look, the number one trend is we have this rapidly aging population without enough people to take care of them. And that there were 54 million unpaid caregivers in this country and who are taking care of a loved one. And the second trend was hospital at home and the fact that the four walls of the hospital are breaking down. The healthcare system really is starting to meet patients where they are. And how can we make the home now a venue of care? And so we said, what can we do to put ourselves at the center of those two trends? And we said, look, we've got intelligent ambient sensing as part of our product stack, which means that without a wearable, I can detect your heart rate. I can detect your breathing rate. I can detect where you are in a room. Are you in bed, out of bed, etc. And then we match that with a large language model that could actually intervene at the point of care. And so if I can put the patient in context and I can use artificial intelligence to intervene, I can help seniors adhere to what are overwhelmingly complex care plans. And when you don't, as a senior, adhere to your care plan, Tracy, where do you end up?
Sick.
Sick in the hospital, right? In a very high cost venue of care instead of being out there living your life. And so our goal is really to help seniors be out there, age in place, increase their health span, and live their life the way that they want to.
Well, I mean, like so much of artificial intelligence and our cell phones, sometimes it's just the reminder to take your pill. It could go younger. What if you forget your birth control pill? What if you
Yeah,
forget?
that's right. That's
It's
right.
like everybody a busy mom could use this kind of technology in their home too, just managing kids.
Well, Tracy, on that point, like one of the things that we talk about a lot here at the office is like now with cell phones and with computers and with the internet, like we are bombarded with signal. There's signal everywhere, whether it's Wi-Fi, whether it's an audio signal that we can listen to coming off, you just speaking and the phone listening to you. There's just all of this signal. And we wanted to be a company that made sense of that signal and that increased the signal to noise ratio that allowed us to take all of this, all the signal we're being bombarded with and make sense of it, right? And use it to like drive an insight and then use that insight to drive an intervention. And at the core, that's what we're really trying to do with the technology. We're just applying it in the senior care space.
You mentioned something I'd read that use your voice, that there
Yep.
was something to tell us about that.
Yeah. So when we thought about the senior population, I've seen companies out there that do remote patient monitoring and you have a device and you've got a tablet by the bedside and, a lot of seniors still don't know how to use their iPad or their iPhone and that type of technology. So when we were thinking about the platform, we're like, what is the ultimate video, I'm sorry, not video. What is the ultimate interoperability tool? Right. And it's your voice. So how could we help patients use their voice to navigate a really complex problem and basically break down the friction and make it as simple as possible for you to like take healthcare into account and make it part of your lifestyle. And the voice was a big part of that. If we could have a conversation with you when you got up in the morning that said, "Hey, Tracy, how are you feeling?" and have that be the start of a healthcare encounter. Well, geez, Jamie, you know what? I woke up and, my knee was sore this morning. Oh, on a scale of 1 to 10, how sore was your knee? And walk you through that cascade of just a dialogue that you might have with, a family member, but then
Right.
use that to activate a healthcare episode and notify your care team so they can stay apprised of how you're feeling and whether there's any concern of you being in a decompensating cascade. We can do that with the platform.
So with memory problems, do you already say these are the big three? These are the first, most immediate problems of patients. I mean, are most of the patients, there's three or four things you must do?
Yeah. So in creating the product roadmap for Cairns, one of the things that we really wanted to do was not create a product how we thought it should be. We wanted to build a product with how the market thinks it should be. Like we really wanted to take a market-based approach to our product market fit. So what we did was we went out and we secured co-development partnerships. We have a number of them. The first one, just to bring up the use case that you're talking about, is with Indiana University Health, in collaboration with a company called IDL. And what we're doing is we are building out an Alzheimer's use case on our platform. So Alzheimer's memory care, using our radar to detect how a patient sleeps and see whether that's an early indicator of, potential Alzheimer's symptoms, et cetera. We have a phase 2B study that we are submitting in collaboration with the Mayo Clinic. We are working with a remote patient monitoring company and chronic care management company to help increase engagement on their platform. Because what happens is a lot of patients, right, non-compliance and not being adherent, get sent this equipment, but they don't measure themselves when they should. And the reminder from our AI can help them increase their compliance with those measurements. So we're also talking to an independent living organization who wants to use the platform to help mitigate mental health issues and loneliness. So it's across the gamut of those things. Those are really the major areas that we're focused on.
Have you created any new technologies? I mean, you're talking about the platform. Are you going to be a font of new devices, or are you using devices that are out there to be a part of your system?
We have created our own device called Luna. It's the same name as our AI. And the Luna device is it's actually right behind me. I think there's one
Oh,
right. That's Luna, if you can see Luna,
very
right?
pretty. It
Sits
looks like
on,
a,
yeah. We spent a
yeah.
lot of time on the design. And Luna sits on your nightstand and has a radar dome built into it. And the radar is what does the ambient sensing. So using the radar, we can detect heart rate, breathing rate. We can again put you in context in the room, whether you're in bed, out of bed, and use that information to launch the intervention.
Mhm.
So our heart rate and breathing rate right now is not FDA approved, but it's on the path to FDA approval. But we don't need it to do what the work that the platform is supposed to do, which is like, oh, look, there's a change in behavior and a change in data here that leads to us wanting to intervene or at least notify the clinical team. And so that's been a big thrust of what we're doing. And the device is Wi-Fi enabled. We're launching cellular on it this month because a lot of homes don't have great Wi-Fi. And we want it to be as ubiquitous as possible. And it has audio built into it, so you can talk to the device can talk back to you. We can use that audio as a signal. If someone falls in a room and says, ouch, we can detect that. And, the device also has Bluetooth, so it can be a hub for other RPM solutions. I think we're going to be integrating other devices in the future. We're exploring integrating, Wi-Fi sensing into our platform in some way, shape, or form. So I think that there's a lot of exciting new technologies, like all the algorithms that the radar uses to detect heart rate and breathing rate are all very cutting edge. But it's about the technology almost fading into the background and you being able to just have an easy conversation with it and let the technology do the heavy lifting behind the scenes.
Yeah, that's amazing. Do you have beta testers already? Is this in anybody's homes or?
We have tested the sleep solution in people's homes before, and it proved very effective. The company prior to our arrival had created a cognitive behavioral therapy for insomnia, and it proved to be very effective, where the artificial intelligence could detect if you were restless in bed and then walk you through how to do a bed reset and get back to sleep and clear your mind and do meditations and all those different types of things. But from that standpoint, yes, the program is proven. It's proven that it works. We now are applying it in a new space, and we are going into market actually this month with units to test out our new thesis.
Fantastic. And then you'll publish those results, I would imagine.
Correct.
This is like ring for the brain. I love it.
Yeah, or we've called it a proactive Alexa. Like it really depends. You could call it a bunch of different things, but yes, the concept is it is your digital healthcare assistant And we really want people to be able to build a relationship with the AI so it remembers that they have a dog and what their kids' names are and how old they are. Because the more trusting you are of the technology, the more open you will be with it, and the more issues we can help that patient or that caregiver solve.
Well, that comes to that big, problem. Healthcare startups used to attract funding, but that's not true today. Okay.
Yeah.
Big laugh. Why? I mean, why isn't the money going here? And I'm going to give you the second question to prompt it. What's the role of government with these kinds of, with what you're doing, companies? Does Medicare or Medicaid help? Is there responsibility of taxpayers or the government to say this is what we're going to do to solve some of the healthcare problems? What is that ecosystem of money look like for you?
Yeah, so look, I mean, digital health funding has gone through quite the cycle over the last few years. I'll tell you, we're probably back annually to like 2017-ish levels of funding. We went from 14 or 15 billion dollars of funding to 40 billion during COVID. And that just simply wasn't sustainable. There was obviously a great need at that point in time for people to invest in new technology. And I think we're back to normalized levels of funding, and we're back to valuations that aren't crazy anymore. And to be quite honest, as a founder, it's like a good thing, right? It's much better to be on that path than it is to be part of a bubble. Because you want to be able to like tell the right story for your company and not have to fashion it to fit bubble economics, but rather fundamental economics of how we're changing an industry by bringing these new technologies and services to bear. So we have the benefit of a company of being backed by Khosla Ventures and Lightspeed Ventures. So some tier one amazing funds, leading VCs in the world. And so from a funding standpoint, we feel very confident in our future ability to fund the business, especially with all of the progress and traction and momentum that we have. And so from that standpoint, I feel like not that we're unique in the market, because I think, there are companies that are funded by great financial partners and VCs, but I feel very good about where we stand in that ecosystem and the future prospects, of the business as a result of that. To the second part of your question, look, government, there's the Center for Medicaid Innovation and Medicare Innovation, and they obviously do a lot when it comes to funding new innovations in market. They feel like it positively impact those populations. There's the AARP out there who has their H-Tech collaborative. There are multiple VCs who are focused on investing in age tech. So I actually feel like we went through this cycle where like things were good, things got great, and now we're back to things are good again. And I think things are good is where we want to be. And the government, interestingly enough, the state of New York has been pretty innovative. They invested in a artificial intelligence robot that they deployed for some of their population there. I think they were the first state to do it. I spoke the other day with the gentleman who did that work, and it's fascinating. So it's great to see that states are being innovative, and clearly there's a lot more wood to chop. There was one state that had worked on a pilot program like that, like there are 49 more that could be doing it. But we are seeing a lot of interest in what we're doing. People realize there's a problem, and people realize the only way to bridge the gap between the current clinical team shortage and the number of patients demanding services is with the technology.
So, how long before I can have one in, my family's home? My parents are.
Yeah, great question. So we're rolling out to our co-development partners this next quarter, and would anticipate hopefully by Q1 of next year that we will be available to the broader public or other partners who would be seeking to work with us. We are building a wait list of folks that have developed a keen interest in the work that we're doing and how it can help them. And I'm assuming that after the first 30 or 60 days of us doing this next phase of our co-development, that we will be ready for a broader rollout.
Jamey, thanks so much for being with us today. I really appreciate your time. This was great.
The pleasure was mine, and thank you for doing important work by spreading the word about these organizations, and thank you for spreading the word about the work that we're doing and the impact we want to have. These are conversations that people need to hear, so thank you for what you're doing.
Yeah, thank you. Hey, by the way, that was great. You did a great job. We'll edit it down.
I
I
mean,
don't
you trained me.